Hi, I'm Dr. Shah. Welcome to Health Hacker MD. In today's video, I'm going to talk to you about 10 things that you can do to make sure you're healthy enough before you go under the knife. Now that we've gone over 5 reasons that it's important to be healthy for plastic surgery or any type of elective surgery, I'd like to give you 10 of my favorite tips for making sure that you're as healthy as possible before you do any procedures or any surgery. So tip number 1 is get yourself organized and write down either on your computer or on even a piece of paper all of your medical problems. Try to sit down with your loved ones and your family. Remember any medical diagnoses you've had in the past, anytime you visited an emergency room. Write everything down and be as specific as you can with what date you've been diagnosed and what the treatments were. Write down all of the medications that are in your medication cabinet. Write down all the supplements that you take, and if there's too many, just bring them all with you to your doctor's visits. This is really important for your doctor to really get a full understanding of your current health picture. You also want to make sure you write down all allergies you have, whether they be to food or medications, and a list of all the surgeries you've had done, whether under local anesthetic or general anesthetic, and try to remember if you had any reactions to the anesthesia, for example. All of this stuff is really important information. Now that you've got all your information together, what you want to do is go and see a doctor and have what's called a preoperative medical clearance. A preoperative medical clearance is a special type of examination. It usually involves some additional testing depending on your age and what procedure you're having done, such as an EKG or blood work, that ensures that you're ready to undergo anesthesia and to have a surgery done. You're going to heal well. If your primary care doctor or your doctor doesn't normally do this type of procedure, ask them to refer you to someone that does do preoperative medical clearances, because they really are special and they really do take some extra time and some extra investigation. Once you have this preoperative medical clearance done, you want to make sure that you have all the records from these medical clearances in your hands so you can physically take them to your doctor as well. Now, if your doctor is confused as to what he or she needs to do in this preoperative medical clearance, I've also included a link to a letter that I send with my patients to their doctor that gives them a very thorough understanding of kind of the minimum requirements that I have to have surgery done. Third tip is, of course, if you don't already have a doctor, you need to get one. Call your insurance, ask them what doctor's on your plan, or just go to your website, your local medical society, to try to research doctors and find one that you can develop a long-term relationship with. It's really important that you see the same doctor again and again. If you're the type of person that goes to emergency rooms or urgent cares every time you get sick, that really isn't going to help you to get ready for surgery. Someone really needs to have a deep understanding of what your medical issues are, both mental and psychological, in order to make sure that you are ready to undergo a surgery. Tip number 4 is to be honest. You really have to be completely honest with your surgeon, your anesthesiologist, and your medical practitioner about all of your medical history, because this can really help us determine what is going to work the best for you, but also what's going to keep you safe. Small details that you might think are not important, like you smoked in the past or you're currently smoking, or even you just had a little bit of a cigarette last night at a party, or maybe you did drugs in the past, or you're trying to get off drugs right now, or you've been addicted to prescription pain medication. Those are really important details that make a big difference in the safety of your surgery. So make sure you're fully honest, make sure you disclose everything to all the doctors, and whether you write it down or tell them verbally, you really want to make sure that you have an open line of communication with your physicians. Step number 5 is to stop smoking. Smoking is deleterious to any type of surgical procedure. It doesn't matter what you're having. You really should stop at least 4 to 6 weeks before your surgery and stay off cigarettes afterwards. It's going to help you heal better. You're going to have a better healing time with your procedure. Your recovery is going to go a lot smoother. Super important to make sure you quit smoking. There's another video on this topic as well that kind of goes into the details about why it's important and also gives you some hints on how you can quit. Tip number 6 is to optimize all of your medical conditions. So remember I said elective surgery is a type of procedure that you can choose when you do it. There's no emergency or anything pushing you to the operating room. So this is where you really want to take 3, 6 months, or even a year preparing with your doctor, going to medical visits, getting all of your chronic medical, whether it's high blood pressure, diabetes, obesity, metabolic syndrome, prediabetes, maybe an autoimmune problem. All of these things need to be sorted before you have surgery done to achieve the most optimal outcome, not just in your results, but also for your safety. Tip number 7 is to make sure that your health insurance is in full force. Call your insurance company, make sure everything is paid up and you have your deductible met if that's something that's important to you. A lot of insurances do cover any potential complications or hospitalizations from any type of procedure, but you want to make sure you talk to your insurance agent and make sure that that kind of thing is covered. If your insurance doesn't cover it, you're going to need to be financially prepared to take care of any complications that might occur. So make sure you know what your insurance covers and doesn't cover, and make sure your insurance is in full force before you go to the operating room. Tip number 8, eat right, sleep well, and exercise. These are the 3 pillars of health that I talk to all of my patients about. You want to make sure you get on the scale, see where your weight is, see where your body mass index is. This is really important. If your body mass index is too high, you probably need to wait before you have any type of cosmetic surgery procedure done. I have another video about this that explains in detail why it's important, what your body mass index needs to be, and some tips on how to get you there. Sleeping is also extremely important. Without adequate sleep, you can't lose weight, your body can't heal, your immune system is depressed. You just need to get 7 to 8 hours of sleep. And if you're not sleeping well, or if you have sleep apnea, which is where you stop breathing at night, you are really going to have a hard time recovering from any type of surgery. Get your sleep in order, talk to your doctor about it. You might need a sleep study to figure out why you're not sleeping well, but take care of this before your surgery, not after. Tip number 9, make sure you understand all of the risks of the procedure and how likely it is that you will experience any one of these potential risks. Risk is part of any type of surgery. Almost every surgical procedure you do has the risks of anesthesia issues, potentially bleeding, healing problems. These are risks that are common to all surgery and just going into the operating room. However, there are specific risks for every single procedure that you must become aware of. You need to sit down with your doctor or their nursing staff or their PA, for example, and go over all of the risks and details. Every physician will give you what's called an informed consent that delineates all of these risks. Don't just take those papers and throw them to the side. Read everything, make sure you understand those risks, make sure you have a game plan of what you're going to do in case you experience one of these risks, and make sure you and your family are prepared to handle these types of issues after the procedure. My final tip number 10, is if your doctors all agree that you should not do a surgical procedure, whether it be cosmetic surgery or general surgery or orthopedic surgery, don't push it. I think a lot of people try to push a surgical procedure and they think that they're superhuman and they'll make it even though they do have risks. But if your doctors are advising against it, take a step back, get your health in order, and go for it when you're healthy and they do think it's going to be safe for you. Don't push your doctors into doing something that they advise against doing or that they feel the risks are too high. All surgery, there's a risk-benefit ratio, and if the risks of surgery outweigh the benefits of the procedure, you really should wait. And this is especially important with elective surgery. Thank you for watching 5 reasons you should be totally healthy before you undergo elective surgery. If you have any questions or comments, I'd love to hear them in the comments below, and I'll try to answer all of them as soon as possible. I'd also like to ask you to please subscribe to this video series. I'm going to have many more videos that are very important to anyone undergoing any type of elective surgical procedure. Also, buy the book, 10 Reasons to Consider Before Having Plastic Surgery, on Amazon or Barnes & Noble or anywhere you can buy books. And finally, feel free to go to the website virtualconsultation.com if you would like a surgical consultation for any type of cosmetic plastic surgery procedure with myself. Thank you.